This presentation focuses on support workers as central and highly influential actors in the sexual and reproductive lives of intellectually disabled women living in residential disability services. Exploring support workers' accounts offers a way of examining how power is exercised in key institutional relationships and settings in relation to organizational policies, values, and employment contexts. This presentation is based on the findings of a qualitative study on support workers' responses to intellectually disabled women's sexuality and reproductive health in Aotearoa, New Zealand, conducted with my master's student, Olivia Bloom. We used reflexive thematic analysis and a post-structural feminist approach to reproductive justice to analyse interviews with 7 support workers from across disability service providers. Our analysis of the support workers' accounts generated 3 themes representing distinct patterns of talk about supporting client sexuality and reproductive rights. We were quite interested to see that one of these appeared to represent a way of talking that seemed more empowering for clients. The first 2 themes were obviously problematic. They either supported the limitation of intellectually disabled women's sexual expression or ignored it as a potentially integral aspect of their lives. These discursive effects clearly serve the ableist status quo. In the first theme, which we called "They're Just So Vulnerable," the emphasis is on vulnerability. The women are infantilized and depicted as unable to exercise sexual control or as sexually naive, rendering them incapable of being good sexual decision makers, and so needing protection. Participants therefore endorse minimizing clients' sexual expression to practices that they consider safe, usually non-procreative, solitary, and private. As a result, service users' sexual behavior can be controlled and their sexuality restricted. And the second theme, which we called "We Had Better Just Leave It at That," sexuality is not restricted outright, but rather sidestepped, following the tendency of disability organizations to overlook service users' sexual and reproductive health and rights. Participants described offering service users support for sexual and reproductive health and rights as too challenging to implement and/or manage, and ultimately too risky for them to undertake because of institutional barriers. The effect of this talk, therefore, is avoiding the service user's sexuality. In contrast, the third theme, which we called "We Have to Correct Them to Make It Safest," we noticed seemingly more progressive talk, supportive of service users' sexual rights and pleasure. Talk in this theme overtly champions intellectually disabled women's sexual rights. On closer inspection, however, we discovered that it is also problematic because rights discourse is ultimately undercut by a discourse of sexual risk. The risk discourse constructs sexuality in the context of intellectual disability as uncertain and risky, and so support workers only endorse sexuality based on ideas of what they consider to be normal, appropriate, and healthy sexual expression and practice. The sexuality of service users is therefore still regulated as it is directed toward normative expression. This demonstrates the limitations of the rights discourse. The subtlety of this talk shows the pervasive, sometimes insidious nature of sexual ableism and the critical role played by sexual risk discourse in upholding it, such that it undermines even more progressive approaches to the sexuality of intellectually disabled women. All 3 of these ways of speaking, even the seemingly more progressive talk, work toward the management of service user sexuality, be it through denial or allowing conditional sexuality. All 3 patterns of talk draw on the sexual risk discourse, invoking notions of safety and normative ideals to rationalize and justify the management and regulation of sexuality, albeit to varying degrees. As such, Each upholds and reinforces uneven relations rooted in sexual ableism and constrains service users' sexual agency to some extent. Ironically, though protection informs all these themes, ultimately, intellectually disabled women are exposed to harm through the diminishment of their sexual agency, silencing of their needs and concerns, and reinforcement of deleterious norms and power relations. Moreover, a sexual risk discourse allows regulation to pass as protection, justified as being in service users' best interests, and so for sexuality to be more subtly regulated. Supporting the sexual and reproductive agency and rights of users and intellectually disabled women more broadly requires a fundamental shift from a risk-oriented view. Many argue for a rights perspective as an alternative, but our findings highlight the limitations of a rights-based focus. Support for sexual and reproductive rights can be sidelined by paternalistic notions of service users' best interests, supported by discourses of sexual risk, developmentalism, and traditional gender roles. We advocate instead for the expanded view of human rights teamed with a social justice orientation offered by the reproductive justice approach. As well as a theoretical lens, this approach provides a holistic, intersectional framework for policy. It highlights the social context's crucial role, including the critical aspects of relationality and sustaining environments. It can therefore help challenge individualistic constructions of disability and risk in line with the social model of disability, exposing and challenging protectionist discourses and underlying sexual ableism.